We discussed diet and microbiome interactions in oncology in this session. While patients want to know what they can eat or what dietary changes they can make, I think we surveyed patients with plasma cell disorders and saw that the majority had questions around this. And being able to research and study this helps empower patients and gives them more information on what they can do for themselves. We think about diet microbiome interactions through two different areas. So one is different dietary patterns. So dietary patterns could be like a whole food plant-based diet, a ketogenic diet, a low carb diet. It's certain dietary foods like maybe beans or whole grains or specific food groups, and then supplements too, like probiotics or prebiotics. And so we talk about the differences in these different interventions, and dietary interventions can affect the microbiome, and we could consider this in also three broad groups. And if you think about it as diversity of the microbiome within the sample or within multiple samples, and then you can think about it as microbial function, like butyrate producers, which are good bacteria that make butyrates, which are short-chain fatty acids that have anti-cancer inflammatory effects, or nitrogen recyclers, and then specific bacteria like microbial species like Faecalibacterium prausnitzii or Clostridium butyricum. These are other healthy bacteria. So I think, when you see studies around diet microbiome interactions, you're seeing them describe it in these different ways. We then talked about how diet can affect the microbiome, and this may be impactful in the prevention, treatment, and survivorship setting. So in the prevention setting, when you think about it, it is like, can we have dietary interventions or lifestyle interventions to reduce the risk of progression to cancer? And in MGUS and smoldering myeloma or precursor plasma cell disorders, we have a nice opportunity to study this to understand if this could affect it. We do know that patients with an elevated BMI are twice as likely to progress to myeloma. And so we had the pilot NUTRIVENTION study that was enrolling at Memorial Sloan Kettering Cancer Center, and it was 20 patients with an elevated BMI with MGUS and smoldering myeloma. We gave them 3 months of a whole food plant-based diet, so a diet with minimally processed plant-based foods, and 6 months of nutrition counseling, and followed them for a year. On this study, we saw an improvement in BMI, improvement in insulin, IGF-1, adiponectin leptin ratio, so markers of insulin resistance. But we also saw an improvement in the microbiome, where we saw an increase in the butyrate producers and butyrate concentrations. We have early data from a couple patients who had rising M spikes prior to going on to the study, but seemed to have plateaued. This was just 2 cases that I illustrated in the talk. We still have to analyze all of the data for the study. Then we went on to discuss the treatment setting. So in the treatment setting, could diet interact with diet affect the microbiome and lead to any synergy with immune therapies, especially such as immune checkpoint inhibitors or CAR T-cell therapies? And while we don't have as much data in the heme malignancy setting, a few examples would be through melanoma. And there is a study looking at the dietary fiber intake in patients with melanoma, and those who had high dietary fiber intake were more likely to have a longer PFS than those who had insufficient fiber intake or also had sufficient fiber intake with probiotic consumption. So here you can see that diet is working synergistically with the immune therapy, like the immune checkpoint inhibitor, to improve progression-free survival. And then in the third part, we talked about survivorship setting, which would be in the post-cancer treatment where patients are on maintenance therapy or on observation. In this setting, we recently published a paper in Clinical Cancer Research, and we discussed that, where we looked at patients on lenalidomide maintenance post-induction and transplant. We evaluated their dietary patterns and their stool microbiome and correlated it with sustained MRD negativity or the likelihood to be in complete remission. What we did see is patients who had higher stool diversity, higher stool microbiome butyrate producers, and higher butyrate concentrations were more likely to be sustained MRD negative or in complete remission, suggesting that the microbiome may affect long-term remissions. We additionally went on to look at their dietary patterns, and we see that patients who had higher plant and seafood protein and higher dietary flavonoids, and flavonoids are plant chemicals, so higher plant food intake was associated with higher butyrate levels and sustained MRD negativity, suggesting that diet may be affecting the microbiome and long-term remissions. So these are just some examples of how diet may affect the microbiome and how this is a rapidly evolving field and where a lot more research is needed, but I think it's a field that could really help patients make changes to help themselves.